Good morning. My name is Larry Bickles. I'm with GerMedUSA, the instrument people. We are your complete place to go for all your surgical needs. If you don't see something here, feel free to ask about it. If we don't have it, we can always make it for you. Just to give you a brief overview, I'm going to talk about this morning the Tplo procedure and the items we have for it. Now I'm basically going to go into the 7 steps involved and how we as a company will supply products for your needs for the 7 steps. Okay, Tplo, as you're well aware of, is a surgery involves removing the torn ends of the cruciate ligament, the medial and lateral meniscus cartilages. The meniscus is concurrently torn in about 40 to 50% of these dogs, and having a torn cruciate ligament, when the femur bone shifts backwards, the femur bone pinches the medial meniscus, causing it to tear from the back part of the stifle joint and flip forward. A torn meniscus will make a patient much pain than a cranial cruciate ligament tear alone. As the patient walks, the torn part of the meniscus may flip back and forth, resulting in an audible popping or clicking noise. An attempt is made to save as much of the normal meniscus as possible and only trim out the damaged portion of the structure. This is called partial mastectomy, which believed to reduce arthritis. Now, the purpose in doing this procedure is you're going to get rapid recovery, better range of motion of the joint, and less chance of arthritis developing. Return to athletic or working activity fairly quickly. Okay, what I'm going to go through now is, these are the steps. Okay, as you see here, we have it set up. Step 1 is locate the joint space on the medial side with a 1.5" 22 gauge needle, which, as you see, this is kind of showing you what a needle looks like. Okay, walk the needle up the tibia, following the medial lateral ligament until the needle stops into the joint space below the femur and the tibia. Locate the joint space on the lateral side with an 1.5" 22 gauge needle. Walk the needle up the tibia directly across from the needle on the medial side. Drill a hole through the proximal tibia with a 7/64 drill bit, which you see here. Start at the cranial edge of the medial collateral, about 6 millimeters distal from the needle on the medial side. Drill through the proximal tibia, taking care to stay as perpendicular to the sagittal plane of the tibius possible. Aim the drill bit to exit the tibia on the lateral side, about 6 millimeters distal to the needle on the lateral side. What I'm going to discuss now is step 2, where you're taking the mandrel, okay, and you're measuring the blade size, which basically can be done by selecting from all the various blade sizes we have, which go from 10